Good afternoon, and thank you for being with us this afternoon. We're all in the Bosque Theater, and we're observing social distancing by far. Today we have three gentlemen, like we did the last time, that will make a statement, but I'd like to ask the mayor right now to make an opening comment regarding what our Spanish translation will be. Mayor?
Yes, good afternoon. Thank you for joining us this afternoon. We're going to do our Spanish translation differently from what we did last time. We have a translator who is watching this live in our studios and will be translating as we go. At the conclusion of this, the Spanish translation will be available about 4 o'clock this afternoon. And I'd like to ask Councilmember Hector Sabito to give that information in Spanish, please.
Buenas tardes. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor en vivo está grabando una traducción en español durante esta conferencia de prensa. La versión en español reemplazará a la versión en inglés en el video, y una versión en español de la conferencia de prensa se reproducirá al canal el canal de cable de la ciudad de Waco, aproximadamente a las 4 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en wccc.tv. Gracias.
Thank you very much, Councilmember Sabito, for your help with that. I'll turn it back to Larry Holsey now.
Thank you, Mayor. Our process will be the same as we were last time. We'll hear statements from Dr. Griggs first, who is representative from the Family Health Center. He is the CEO and physician over at the Family Health Center. Then we'll follow that by our judge, County Judge, McLennan County Judge Scott Felton, and he'll make a statement, and then follow that by our Waco Mayor Kyle Deaver. And so now I'll turn it over to Dr. Griggs.
Thank you again, Judge, Mayor, for the invitation to be a part of this conversation with our community. Let me start by giving current cases. In the world, there's been about 2 million confirmed cases. In the United States, 579,000 and 22,000 deaths to date. In Texas, the Department of State Health Services reports 14,624 cases, which it has been about a 5,000 increase from last week. 318 total deaths to date in Texas. In McLennan County, we have had 74 laboratory confirmed cases. There are 23 active cases right now in McLennan County. 4 are currently hospitalized. As of today, the testing data shared, this is shared by Family Health Center, the hospital systems in McLennan County, and the laboratory, the clinic rather, at Baylor University. Cumulatively, we have performed in McLennan County 1,925 total tests. So that makes a positive rate about 3.8%. Of those who are positive, the hospitalization rate in McLennan County is 23% right now. So that's an update on current cases. I also want to share that there is a mental health support line. This is a mental health support line that the Texas Department of Health and Human Services offers. It's a 24/7 phone system to help people who are dealing with anxiety, depression, stress, grief, or worry. The number is area code 833-986-1919. So 833-986-1919. That's the mental health support line from the Texas Department of Health and Human Services.
Okay, thank you, Jackson. Judge Felton.
Good evening, everyone. We are well into this situation with the COVID-19 in our community. I want to extend my thanks to everyone who has really taken to heart the vastness of this situation and have followed the orders that have been laid out that we believe will help reduce the impact of COVID-19. on the citizens of McLennan County and as well as the rest of the state. As I drive around the communities, I see that there's not a lot of activity at all, which is a sign of shelter in place and what it does. I do believe, and I seriously believe, that our situation would be much worse if we hadn't adhered to these rules. And I know they're tough on people. And we also know that there's a financial impact as well that's out there, and it does not go unnoticed. I can assure you of that. In regards to how the county's financial situation is, and all going into this, that we have put our plan in place a good many years ago to build up our unassigned fund balance to be able to handle disasters. We had no idea one like this would come along, but we feel prepared to handle this. The community as a whole is very, I think the spirits are good. We get a lot of positive calls, and what can we do to help? In regards to what people can do to help, we do have a need to have more of these face masks produced to get more people protected in our community, and I'm going to give you a couple of websites you can go to make donations. One of the websites would be to www.covidwaco.com, and the other one is www.McLennanCountyCovid.com, McLennanCountyCovid.com. And any donations would be much appreciated. Things like masks and tests and those things are, even though they're talked about a lot, we're a long ways from having the amount that we need. Thank you, Mayor.
Thank you, Judge. I really appreciate you and Dr. Griggs joining us again today and letting the people of Waco and McLennan County know what's going on here in our county and our city. I have the sad news that I have to give that we have our 4th death in McLennan County yesterday afternoon late. 66-year-old white male who had underlying conditions. Every one of these deaths is tragic, and we will have more, unfortunately. So I ask for prayers for the victim and for his family as we go forward. At this time, we will start to take questions.
Okay, Mayor, thank you. These are questions that have been received prior to the press conference, and I'll pose them, and anybody that wants to can respond. First question is, have we learned anything from the data that will give us hope for the future?
Well, if I could answer that one, I think that we know right now, or I know we know, I'm certain that we know that the actions that the community has taken thus far save lives. And I think the main thing that we have learned from it is that we need to continue this for some point in time to be able to manage the amount of movement of virus and be able to save lives. So again, I want to thank the community for participating.
Agreed, Judge. Thank you.
Next question. Are area nursing homes a problem in McLennan County?
Go ahead.
To this one. While nursing homes and skilled nursing facilities are areas that have unique vulnerabilities because of the population, there has been no known cases in area nursing homes. The health district is working closely with the nursing homes in order to make that risk as small as possible that any outbreak does occur. Each nursing home is unique, has its own systems to care for its population, but there's a shared city and system collaboration in order to reduce risk.
Okay, this one might be for each of you. The question is, do you personally wear a face mask?
Well, I'll start. We're not wearing masks in here today because we are appropriately separated by distance. But I do occasionally wear a mask in the community when I'm going to the grocery store or in some other store for necessities, depending on what I think the situation is going to be. If I don't think I can keep adequate social distance, I'll wear a mask.
I have been wearing a mask this past week. Of course, at the Family Health Center, all employees and staff are wearing masks throughout the day, with the exception of when they're in their office by themselves. In fact, I wore mine in today. I was at Home Depot over the weekend and felt a little awkward wearing a mask in public, but I think that's just a hurdle that a lot of us are just going to have to get over because of the asymptomatic spread of this virus. It's important that we do try to wear masks when we're out in public that are particularly areas where people cluster together, like the mayor said, in grocery stores or other locations where people are clustered.
Judge?
Well, I do think wearing a mask when in areas where there's a higher concentration of individuals is important, and it's just as much on us to protect others by having that mask on when we're in populated areas. And you've heard arguments one way or the other, but I think there's no harm in it, and I think definitely sometimes you may have, from what I've learned from Dr. Griggs, is one may be in the early stages of being ill and really not know it, and be spreading the virus. And so wearing a mask could help reduce or eliminate that possibility.
Yeah, I think one thing that's important to note is that wearing a mask does not eliminate the need to keep your social distance. It's just an additional measure. And I found that it kind of helps people around you remember they need to keep your social distance. So I think it's a good idea in public.
Okay, next question deals with equity and access. African American deaths due to COVID-19 are higher in some areas. What is the situation in McLennan County?
Dr. Griggs, will you take that to start with?
Absolutely. Of course, this is a hard topic to talk about because it speaks to some entrenched realities that none of us are proud of. It speaks to a legacy that we're a part of that is unjust, and health outcomes that delineate around race groups are unacceptable realities that are in our midst. This is something that has been accentuated with the COVID-19 pandemic in the United States. I guess I first saw the Chicago reports, the high number of African American deaths in Chicago related to the overall population of those affected with the virus. And then I've seen in the media that the Latino population in New York is carrying a disproportionate burden of the hospitalization and death. This is something in McLennan County that we are very much paying attention to and care deeply about. On the covidwaco.com website, we've added race to the positive cases so that anyone in our public can go and see what is on that website and how the cases in Waco-McLennan County have delineated by race. I've had a conversation with the presidents of the two hospitals. We all share a strong commitment to do everything that we can do in our healthcare space to limit this injustice. I think we all recognize that there are factors and forces that are outside of healthcare that shape health outcomes and that may carry the bulk of the impact around health outcomes. But there are still things that within the four walls of healthcare we can do to limit that inequality, and we're committed to doing it.
Yeah, and I'll say that we have asked the hospitals and the Family Health Center to track the race and ethnicity of the tests, the people who are receiving tests, and that data is not complete yet, but the early data we have seen has not demonstrated, from my analysis, a disproportionate number of people from any race or ethnicity getting tests or being denied tests. But it's something that we are very focused on as a community and want to be sure that we don't exacerbate this problem and make it any worse than it is with the underlying situation. Thank you, Dr. Griggs.
Okay, cities like San Antonio and Houston are offering large citywide testing programs. Will McLennan County do this?
Dr. Griggs, will you start?
Yeah, absolutely. So right now, Ascension Providence, Baylor Scott and White Hillcrest, and the Family Health Center are offering non-emergent testing through primary care. In other words, if someone's sick enough to need emergency care, we want them to go to the ER, of course. But if you're not sick enough that you would otherwise go to the ER, and you think you may have COVID-19 because of fever or shortness of breath, cough, fatigue, myalgias, headache, we're asking that you call ahead and then come see us in the primary care setting so that we can evaluate you and, if needed, do the novel coronavirus test.
And I'll say that in addition to that, we have requested through the state emergency management chain 500 additional tests, and we're also requesting supplies from commercial labs with the assistance of a public health preparedness grant. And so we're doing the things that we can to bring more tests to this community. I don't know at what point we will get to the point where we can give tests to anyone without symptoms. That's obviously the place that we would like to be, but so far the testing is still somewhat limited.
Okay. Have any first responders tested positive?
Felton, do you have that information?
Yes, we've had one DPS officer that has tested positive and since has recovered. And then we have, it's my understanding, one Waco PD officer that tested positive and also has recovered. I'm not sure about any of the first responders. Of course, those are the group that are the high risk and could very well be exposed to the virus. But those are things that we're watching.
Thank you, Judge. I'm not aware of any other first responders, but they certainly are at risk, and they deserve our respect and admiration for the work that they're doing.
Okay, dealing with our parks, will there be any security for the parks that are closed?
Judge, you want to speak to the county?
The county owns one park, which is Trading House Park, which is primarily a place to launch boats to fish. And by the way, we do have a full lake now with all the rains. And but we do have a park ranger that monitors and understands what the rules are on social distancing. And we have not had any issues there as of this time.
Good, good. The only parks facilities that we've completely closed are Cottonwood Creek Golf Course and the skate park. And we will have security visits by parks personnel and park rangers there to be sure that those are not being utilized. All our other parks are open with certain facilities closed, like playgrounds, basketball courts, areas where we weren't able to have people adhere to social distancing. But we do want people to use our parks, especially our trails and our Riverwalk and other trails around the city for exercise. We just ask that you, of course, observe social distancing protocols while you're doing that.
This is a question I know we've had asked several times, and it talks about social distancing. Will you be looking for people who are not social distancing?
Yeah, in our parks, park rangers and other park personnel will be reminding people to observe social distancing if they encounter that. We are not out, we don't have people out driving the streets looking to see if people are social distancing. That's just not, it's not practical. But we do ask you to do your best, and if you see others, you might gently remind them to keep their social distance.
Okay.
Are there any positive cases in the jail, and what's being done to protect the people in the jail?
As of now, we do not have any positive cases with any of the inmates or the folks that we have working there, the jailers and the administration of the jail. We have about 1,040 inmates there, and we have about 350 jailers, all of our staff that come in and out of there are the temperatures tested twice a day when they come on the job and as they depart the job. And we feel that that population is, because they're moving in and out, going to work and coming back, may be a little higher risk than someone that's in the jail that is not where we don't have a positive case. So we're really working to check that. We also have protocols in place regarding folks that are coming in, being booked into the jail on where they are isolated for a certain period of time until they can be moved into the general population. It'd be good if we had more testing available for that bunch, because if it does, if we do get an infection in jail, and we've seen it in the state side, that it could be really hard to manage. But we've got a good program. We've got extra space in the jail to be able to isolate individuals. We have certain areas that have negative air pressure, which means we can put infected people in there and not be worried about sullying the integrity of the air that circulates within the jail. So, but it's something we work on every day. We've got excellent staff there that works closely with the third-party medical provider, which specializes in jail institutions, and so we think we're on top of it, but we know that it could happen, and we're prepared when it does.
Okay, this is probably for Dr. Griggs. Is antibody testing available in McLennan County?
To the best of my knowledge, no. But let me clarify a little bit about antibody testing, because I think that's a burgeoning conversation right now. Antibodies are a key part of a human's immune system. Immune cells make antibodies that attach to germs, viruses, bacteria, and once those antibodies attach to those germs, it allows the body to destroy and eliminate those germs. The antibody testing for the novel coronavirus that's currently on the market are in two forms. IgM, immunoglobulin M and immunoglobulin G, IgM and IgG testing. So these are the two forms of antibody tests that are available. IgM testing becomes positive in about 5 to 11 days, and it doesn't seem to be any better than the current PCR test, reverse transcriptase PCR test that we currently have and that we're using in clinics and hospitals. The IgG test turns positive closer to about 2 weeks, and theoretically the IgG test could indicate immunity. The problem is with this test is that it's really hard to confirm that an IgG positive test does actually, so theoretically it may convey immunity, but does it actually convey immunity? So we would have to test a population to be sure that an IgG test did in fact confer immunity, and that's a really difficult test. I mean, you'd have to essentially have a population who was positive for IgG and then expose them to the coronavirus and see if they got sick. That's again a kind of a difficult test, as you can imagine, to orchestrate, and maybe unethical. So the IgG test is problematic also because it has some positives that are not true positives. So the IgG test can come back saying, yes, you have immunoglobulin G to the novel coronavirus, and indeed you don't, so a false positive test. Now, the false positive rate's not very high, but when in a community like ours, we have an actual rate of disease that's probably less than 2 or 3%, if we were to begin to use IgG on lots of people, testing on lots of people, and we start seeing some positives, we could communicate to that group of people who are positive, you don't have anything to worry about because you're immune. And actually, they aren't immune, and it's a false positive, and they would go out and potentially get exposed to the virus and then get sick. So the test is problematic. It may have utility as the tests get better, and as the prevalence of disease climbs, we may find a clinical niche for using the test. But right now, we're not using it, and from my standpoint, it doesn't have much of a role at all.
Thank you, Dr. Griggs.
Okay, the Governor Abbott could reopen businesses soon. How do you feel about that?
Judge, would you like to start?
Yes. Well, of course, the governor's order would be a very strong order, very much of a lead order that comes to the state. I think the governor understands, I'm sure he does, that there's a difference in the different counties. There's 254 counties in the state of Texas, and there's none of them that are identical. They're all different, and they have their different densities, their different type of populations, or different ethnic backgrounds, or socioeconomic side, the diversity in manufacturing and other things that make us different. So we are hopeful that at that point in time when he starts making rules that they're pretty general, that we can end up tailoring those to fit our county, that may make us move slower or faster than what a general guideline might be. But the mayor and myself are very appreciative that we have a lot of talent in this community, and that we can draw on them to help us decide how to make those judgments. And in that, we would be looking for people that represent the medical community and a broad portion of that, all the way from hospital management to epidemiology type medical folks, and then business leaders, folks that have been around, really understand what makes our community click economically, and then also economic development professionals as well. And we want to get to that point, but we want to get it to that point in a safe way as we possibly can. And so having all those different data points that we can look at and bringing in our friends to help us make those judgments is kind of our focus right now.
Yeah, thank you, Judge. You know, the things that we have been reading and what we understand is that we've got to have some excess capacity in our hospitals to be able to do this. We've got to have adequate testing. We've got to have adequate ability to identify close contacts of people who test positive and then track those people and be sure that they are staying isolated. And we've got to have plenty of protective equipment. Some of those things we're getting better at. We are working now to start standing up more of the contact tracing and isolation. The thing that we are woefully short on still is testing. You know, I've heard the number of 1 million tests a day need to be available in the U.S. and administered in the U.S. each day for this to be safe. That number may not be right. It may be some smaller number. But if it is the number, that would mean we would need about 800 tests a day here in Waco. And to date, we have administered a little under 2,000 tests. And we have no way of testing 800 people a day, and I don't know when that will come. The other issue is that Dr. Griggs has pointed out, is that the tests that we're currently using have about a 30% false negative rate, so that you may test negative, but you still have a 30% chance of having the virus. And so the testing needs to improve, and it needs to be more widely available before we can do this. But I know both Judge and I will be looking at, you know, at what point can we start easing these restrictions. The governor has said it won't be just a flip of the switch. And I appreciate that, because that wouldn't be wise. But we want to get people back to work just as much as everybody wants to get back to work. It is affecting all of our people. It's affecting the businesses that we're involved into. And we recognize how damaging this is to the economy.
Throughout this whole virus situation we've dealt with, we've heard about flattening the curve. What are we looking for in a peak?
Dr. Griggs, can you speak to that?
The reason that we have communicated the value of flattening the curve is because in those areas where the critical cases have exceeded hospital capacity, we've seen mortality that's been unacceptably high. In other words, because there's not a cure for the disease, we have to wait for the body's own immune system to destroy the disease, and during that period, we provide the supportive care in the hospital. So if somebody's lungs shut down, we put them on a breathing machine to help them breathe while their body fights the virus. So you can imagine in environments where there are very critically ill people and capacity of the hospitals has been maximized and the need exceeds the capacity, you can imagine why there is excess death. By flattening the curve, by lowering that peak of need, the mortality drops. So the expected number of deaths is decreased. However, of course, it also slows the spread of the virus, and so while the same number of people might get infected in a community, they get infected at a rate that the hospitals can keep up with. So that's why that's so important to flatten the curve. Right now, predictions are the peak will be as early as end of April. So April 29th is the IHME prediction for the peak need in the hospitals. There are other predictions that range out as far as late May, early June. But the IHME suggests that on April 29th in Texas, that there will be 3,000 beds needed across the state. And the next day, April 30th, will be the peak of the numbers of deaths per day, so around 71 deaths per day. The range there, though, in this predictive model is wide, from 16 deaths a day to 222 deaths a day. That's again in Texas. The projected total number of deaths is somewhere right now around 2,000 to 8,000 with social distancing. So that's really where the deaths plateau out, with social distancing, between 2,000 and 8,000 deaths in Texas. Using the IHME model and extrapolating the data from our own county, the peak hospital demand in McLennan County is not expected to exceed our own hospital capacity. So that's really good news. We are still nevertheless planning we have contingency plans in place. We're planning for alternative care sites. If the surge exceeds what's expected, we will have site in place to take those excess patients and take care of them. But it's not looking like we're going to need that alternative care site, which again is good news, because we want patients cared for in the established hospitals with all of the workflows and equipment and professionals that are at those sites. And it's also worth mentioning that thus far, McLennan County's incidence and hospitalization rate is about 60% of the rate of Texas as a whole. So in other words, we are doing a really good job of social distancing and flattening the curve right now.
Okay, my final question is, won't we all get this virus eventually?
Dr. Griggs.
So maybe is the answer there. Will we all get this virus eventually? I feel a new sympathy for those that predict the weather, because prediction models have such a wide margin of error, and in terms of the number of total of the population that will be infected at some point with the novel coronavirus, the range is from 20% to 80%. if we adequately social distance and we keep that number low, and we bide our time until a vaccine is available, then it may not be that over half the population eventually gets this virus. And that would be really good news for all of us, because right now the mortality rate in the United States is about 4.4% of those that have the virus are dying from the virus. So that it gets kind of scary when you begin to think about half the population getting the virus and 4.4% of those dying from the virus. So if we can keep those numbers low, if we can keep it down to 20% or less of the total population ever actually having the virus, and we can get a vaccine operational, then it may be that when we all get vaccinated, that we can stop this virus in its tracks, and it will stop spreading from person to person, because we have these barriers of vaccinated people that the virus can't pass through, and we'll keep that number of those exposed, and so those that die from this virus very low.
Okay. Thank you, Dr. Griggs. We have a few additional questions that we received
All
from the press.
participants are now unmuted.
Good. We have a few additional questions that were submitted by the press before this press conference just a little while ago. And then after we get through these, we'll take a few more questions from press that's on the phone with us. The first question is, are the city and county working on a contingency plan to offset lost tax revenue? Will property taxes be impacted? Judge, you want to speak to that?
Well, more than likely they will be. I can't imagine it not be, especially income property that has tenants that are closed right now, and they quit paying their lease or whatever, and so it'd make a case for a property owner to challenge those values. But insofar as a contingency plan, the first thing that we would do is try to understand how that's going to impact us, and the certified values will be out before long, and then the challenges to those values will come after that. The other thing is on a piece of income that the county gets that a small portion of is sales tax. And of course, as you know, just like I mentioned earlier, driving around town, there's no one down here.
Right.
And so all the retail businesses are suffering big time, and therefore the taxes based on that would be affected as well. Additionally, just one other thing on the, as you know, we have a venue project that is going on, about a $40 million project that is funded by, we sold the bonds based on income coming in from hotel tax and rental car, and that's going to be affected very much so. The bonds are sold, and right now we have a good coverage. We should be able to make her, even if we didn't get any more money in, we should be able to cover our debt service for another couple of years, and so hopefully we'll get back to opening up hotels and those things. But and then as far as we felt like that several years ago we really cut a lot of made some pretty significant cuts in operating in as far as the county goes. But I think that when you get into situations like this, you got to really look at that and keep our costs down. And then very appreciative that we've had the opportunity to build up a fund balance to face these issues as they come up. But that's kind of what we're doing, Mayor.
Right, Judge. Thank you. Yes, the judge mentioned sales tax, and we spent a good portion of a city council retreat yesterday afternoon talking about the budgetary impacts from the shutdown. And we project that sales tax will be down at least $8 million. Sales tax revenue for the city will be down at least $8 million as a result of this. There will probably be additional property tax impacts in next year's budget. We'll have to see how that looks as it comes along, and it may even go beyond next year's budget. The good news is that, like the county, the city was in a strong financial position going into this crisis, and we will manage it with sound financial practices, making cuts where we have to come out of this in a strong financial condition. Next question is, does the city have a formal plan in place to extend current council terms that end on June 1st? This one is personal to me. Having delayed our election from May to November, that has the effect of extending the terms for the council members and the mayor who would have had successors elected in May until that next election is held. The city charter provides that the mayor and council members serve until their successors are elected. So we will not have to take any formal steps to make that happen. We have asked Governor Abbott to allow us to have our election on July 14th as an option for the November race. We just sent that request in to him early last week, along with 15 other cities and Midway ISD and Waco ISD. So it would be better if we could go ahead and get the elections held and transition government in closer to the normal timeline. And so we hope Governor Abbott will grant that request. Next question is, what percentage of city staff have been furloughed? We've had about 6% of our employees who have been furloughed and have not worked at all during this time. Another 15% have had their work altered in some way, either through rotations or working in other jobs, assignments to other areas. Next question is, do we expect Governor Abbott to allow non-critical surgeries to be allowed? And if so, at what point? I don't know the answer to that. Dr. Griggs, do you have any idea?
I don't know, and it'll likely be just a risk-benefit analysis that takes place, and I'm not a surgeon, and I can't really project. I'm sorry.
Okay, thank you. And then the last question I have before we get to any follow-up questions from the press is this: 4 people are hospitalized due to COVID-19. How are our hospitals holding up financially due to restrictions without a surge so far? Both of our hospitals voluntarily ceased doing elective procedures before the governor ordered them to stop doing that. They did that so that they could prepare for a possible surge, and it was a very responsible move on their part. But the reality is that elective procedures are a major part of the hospital's income, and so their income is down significantly. And they've had to expend significant funds to get ready for the surge, both in construction projects and other things that they've done to get ready for a possible surge. So like most, if not all hospitals around the country, they are suffering financially. This is a situation where we benefit from our hospitals being part of larger networks. Both Ascension, Providence, and Baylor Scott and White Hillcrest are more robust because they are part of a network, and therefore they're more sustainable. And then in addition to that, we are just extremely fortunate to have the leadership that we have in our 2 hospitals. Our leadership teams are excellent, and I have every confidence that they will get through this. At this point, I will take questions from the press, and I can't tell exactly who all is on the line, so I'm going to go through a list and just call you by organization. If we could start with Waco Tribune-Herald with the question, please.
Hello, all. It's Brooke Crum with the Waco Trib. When Dr. Griggs mentioned the testing numbers, I saw the state had released some testing numbers yesterday. There's quite a discrepancy. I was wondering why that might be, and when those tests, how up to date those tests are.
It's a great question, Brooke, and I don't know. I don't know why the numbers are inaccurate, other than that my best guess is that the private labs are required to report to the state, and there may be some inaccuracies there. I don't know. I know that my numbers are from conversation with hospital leadership and Baylor University leadership, and I think those are the best numbers that we have in our community. Those that go from the labs up to the state and then get filtered and brought back down to our health department and then on to our website. There's several steps there where there are potential errors. So I I think that the infrastructure is going to improve. The reporting is going to get more and more accurate. But right now, it seems a little glitchy at the front end of things.
Yeah, I think it's probably just delays in getting reported through the system. And as Dr. Griggs said, we are getting those numbers now on a daily basis from the 2 hospitals, from Family Health Center and Baylor University, who is testing at their clinic for students who are concerned and have symptoms. So we feel very good about the numbers that Dr. Griggs just released. If there's someone here from KWTX, I'll take a question from you.
Yes, this is Drake Lawson from KWTX. I was going to ask you guys in the same vein as far as testing goes. I know that you guys were asking, I believe, Mayor Deaver, you said 500 additional tests. Are you guys right now worried about the number of tests available for people? How many tests do we have currently in McLennan County ready to give out? And because of the lack of testing that's going around, do the numbers we have in McLennan County accurately reflect the state of COVID-19?
Dr. Griggs, can you take that?
And I'm sorry, I only got part of that question. I couldn't hear.
So the question was, I guess I need you to repeat the question. I'm sorry.
I heard Drake. I heard the total number of tests was part of the question, and then something about the 500 tests. So I'm sorry if you can just repeat.
Essentially, are we comfortable with the number of tests, that we have enough tests? What is the number of tests we have in McLennan County, if you have that information? Mm-hmm. And then do we think that the testing adequately or correctly estimates the number of positive cases in our county?
Okay.
Yes, that's essentially what I was asking. Yes, Mayor Deaver.
Thank you.
All, again, great questions. I don't have the total number of tests that are available in McLennan County. I have learned even this week that the lab that we use has been replenishing our supplies at the rate in which we're using them at the Family Health Center. So I learned that on Monday, which is great news for us. I've also learned that the media that we're using, so when you collect a swab, you need a particular type of Dacron swab, and you need the right kind of media. And then, of course, you need the staff and the transport to the commercial lab. And then they have to have reagent and the equipment and the steps that they then employ. So on our end, the transport media and the swab are the key pieces. And the transport media, we have learned even this week that yesterday learned that saline has been validated in their testing equipment in our commercial lab that we use, which means that it's, I mean, and of course saline is cheap and readily available. So these barriers that originally existed, there was a time in which we had very, very few tests at the Family Health Center, and at each different juncture where these barriers are eliminated, we're celebrating because it allows us to open up testing more and more to be able to test people who, you know, for a long time, our chief medical officer had to approve every single test because we had such a short supply. And now we are liberalizing the use of those tests, and our testing criteria is loosening almost on a weekly basis. So we're very optimistic, and at the same time, we don't have an infinite supply, so we are still monitoring those tests. But the shortages that we've been living with may be, we may be getting some relief from those shortages in the very near future.
Okay, thank you, Dr. Griggs. Is there a reporter on the line from KXXV?
Todd Unger here, guys. Just a quick question for the mayor and the county judge. Some local entities across the country, we're even starting to see it a lot more here in Texas, are starting to require masks in public, even look at curfews. Has there been any discussion about that locally in Waco, in McLennan County, and what's the rationale behind that?
So far, we have not had any discussion about requiring masks. I've gotten several emails from citizens asking us to consider that. I would say that since the governor issued his order, we have not made any additional changes to our order. And so I think that going forward after April 30th, and even potentially before that, we might consider that, but to this point, we have not considered it. Is there a reporter here from KCEN? If not, is there a reporter here from KWKT?
Right here, this is Shaquille Omari from Fox 44. So
Yeah.
a lot of hair salons and barbershops are basically out of work. A lot of people are out of work because those are not considered an essential business. Do you guys have plans on adding those to an essential business? Because people are saying that liquor stores are open, but the hair salons and barbershops are not.
I'll speak to that, and then I don't know if you'll have any follow-up. At this point, we do not have any plans to add them to essential businesses. And I understand that those industries are certainly hurting, and the people that work in them are hurting. Those are also some of the closest contacts that you have with people is when they're cutting your hair or doing nails or some other salon-type treatment. And we simply can't see a safe way to do that at this point. And my hair is getting longer and longer as we speak. So I know everybody needs a haircut, but more importantly, those people need work, and I hope that they are using the resources that are available on covidwaco.com to apply for the PPP loans and other assistance that is available through the federal government. I am very keenly aware that those people are hurting badly right now. Is there a reporter here from KWBU? Is there anyone else on the call who has not asked a question? Okay, I think we'll have time for maybe one more quick question from each of you that are here, and then we'll wrap it up. Brooke, do you have anything else from Waco Trib?
Yeah, actually, my phone dropped the call when Dr. Griggs was talking about the disproportionate rates of Black and Latino people being affected by this disease. At least 2 of our 4 deaths have been Black men with underlying health conditions, I believe. Can you tell us anything more about these other 2 deaths? Were they also a member of that population, anything like that? Because it does seems to be an emerging pattern there.
Great question, Brooke. And right now, what I know is that 2 of those who have died of COVID-19 are African American. 1 is Latino, and 1 is white. And that's all the information that I have. I don't have additional information. With 4 deaths, of course, we're very concerned about the disproportionate minority representation in those 4 deaths, and with 4, it's such a small number that we're not sure if that is just by chance. It's 3 of 4 are minority, or if that's going to be a trend that holds up as the numbers grow. But we're watching it closely, and again, doing everything we know to do. And I think that as we are, I could speak now from the Family Health Center standpoint. We are listening to community members. We have actually formed a COVID-19 Race Equity Committee that includes community members, our own internal race equity committee, and then community members as well. We've invited in to be a part of this committee to learn, is there anything that we can do that we're not thinking of internally right now to help rectify this reality.
And I want to commend Dr. Griggs on establishing that Race Equity Committee at the Family Health Center and reinforce that we have spoken to the hospital leadership at length about this topic, and they are very concerned about it as well and wanting to do everything they can to eliminate any race bias from any testing opportunities, and certainly the treatment that they are giving to all their patients is excellent treatment, and we know that. The next person is Drake from KWTX. Do you have a question?
Yes, sir, Mayor Deaver. I had a question for you and Judge Felton regarding kind of, you mentioned this earlier, but maybe to expand upon when the businesses will reopen, when we can kind of get the economy going back. Is it one of those things that you're waiting until, or are we waiting until we actually get a vaccine? What is the clarity? Is it still unclear? Kind of just maybe expand when you guys are looking for that point when the economy will reopen.
Well, I don't think we can wait until there's a vaccine available. I think the information there is that we're at least 12 months, probably 18 months away from having a vaccine. So we're going to have to find ways to get back to work in a safe way prior to having a vaccine. But at the same time, I don't think we have a specific date that we can point to and say that's the date when we can begin. I'm very interested to see what the governor announces on Friday. He has said that he has a plan, and we are just anxious to see what he has, and we are in discussions about how we might begin to open it up, but it is still just way too early for us to roll anything out, and we just got to play it day by day and week by week right now. Judge, do you have any?
No, I do not. I think you're exactly right. We're very interested. The mayor's background and my background are business, and so we feel like we have a good understanding and how important it is. But yet we started out with the medical side of this thing, looking at how we could address trying to stop the situation or slow it down. And I think we've been very successful on that. So it's not too early for us to start putting those groups together that I mentioned earlier, from the medical side, the business community, and people that work on the economic side of it to help us find that direction to start. So we're very interested in getting to that point.
Thank you, Judge. Todd, let me see here. Yeah. Todd at KXXV.
Dr. Griggs, we've heard some discussion about this globally and also nationally, but how concerned are you about a second wave of COVID-19 coming perhaps late in the summer or the fall, and what kind of local impact could you foresee with that?
Todd, I'm concerned about it. I think that this is maybe more than any time, certainly in my life, this is a time where we have to all work together in our multiple sectors, because I think that if collaboration were to somehow break down and a decision were made on one side of the equation without thinking of the other side, we risk a real calamity. On the other hand, if we ignore the economic needs, we know how important to health and human flourishing economic thriving is. So even if we just think about this in terms of health, we have got to get businesses operational and decrease unemployment and get the economy working. So while our first or most emergent priority was we've got to stop the spread of the contagion. We've got to flatten this curve, or we're going to be in big trouble. Now that we've done that, we've got to figure out, okay, now how do we live with a kind of steady state of we're going to have new cases of infection, and of course we're on I-35 and we can't change that reality. So we'll have people who exit and share the virus, and that will go on in perpetuity until we get a vaccine. And yet at the same time, we have to get businesses going. So I think that monitoring is going to be key. Whenever we start seeing an uptick in the infectivity and the case rate. It's going to tell us, okay, we may need to pull back on the reins a little bit. We got to figure out what are we doing new in the economic space or in the mass gathering space or that's causing new contagion, and we're going to have to pull back on those things so that we can keep infections and spread low. I don't think we'll ever get to zero, but I think we can keep it low enough that that we keep mortality down, and we, of course, not my industry's decision, but my sense is that we do need to get businesses going at some point in the not too distant future.
Thank you, Dr. Griggs. Shaquille from KWKT.
Yes, I already asked my question earlier.
Okay, all right. Thank you, Shaquille. Well, that will do it for questions from the press. I want to thank you all. Those are excellent questions, and I think they're the kinds of things that people want to know in our community. And I just want to thank the press for joining us today and for getting this information out in such a professional manner. I'll ask Dr. Griggs and Judge Felton if they have any closing remarks.
My only remarks are just to, while I continue to feel deep gratitude for our city leadership, I also just want to acknowledge again our hospital leadership, Glenn Robinson, Philip Patterson, Jim Morrison, the CMO at Hillcrest, Brian Becker, the CMO at Providence, Rich Haskett with the Ascension Health Alliance, and then our own medical leadership at the Family Health Center, Kelly Reynolds, Ben Wilson. I feel just I've seen kind of heroism in the healthcare sector that just makes me so proud to be working with that group of people. So I just want to share my gratitude to all of those people.
Thank you, Dr. Griggs. Judge Felton?
Good point, Dr. Griggs. Yes, we do have great hospitals and medical community here. The Hillcrest and Providence side, as I call them from the old days, that are now Ascension Providence and Baylor Scott and White Hillcrest. They've got a deep bench. They're serious about making this community better and surviving this situation. And Family Health Center and Dr. Griggs' leadership with his excellent board has taken a lot of responsibility in this as well. Also, the City of Waco, the mayor and his staff and of city managers and other folks have really working tirelessly to be able to deliver the best messages that we can possibly deliver. Also, the first responders, thanks to them, and law enforcement that have to keep working to provide those services. It's important that we think about them in our prayers and support them any way we can. So I feel, even in this bad situation, I feel optimistic that we'll do it as good or better than any other county can do it. Thank you.
Well said, Judge, and we're so grateful for the great work that you do and that the county is doing for our citizens. And Dr. Griggs, thank you again for joining us. I know you have lots of demands on your time, and we really appreciate you being here to help our citizens understand what's going on here from a medical standpoint. I want to ask for your continued prayers for the victims of COVID-19, both those who are fighting and those who have tragically lost their lives from this disease, and for their families. I would ask, too, that you pray for first responders and healthcare givers and their families. And then also thank you to the essential businesses that have stayed open, the employees in those businesses at grocery stores, at pharmacies, restaurants, places where they serve the public daily, and we need their service, but they are at risk, and they feel that. That goes for postal delivery and those that are shipping packages, as well as plumbers and electricians and construction workers that are doing work in our homes. And then also other workers in our county and city government who are providing the essential things that we need every day. Thank you to our citizens who are doing the right thing. We are making a difference in this fight. We will continue to do so, and this is how we'll get through it. So thank you for joining us today, and I hope you have a good evening.